So let's talk about how we treat now tear trough deformity. We have different products, as you can see here, from fillers, PRP, IPL, radiofrequency. Of course, you can use botulinum toxins, and then you have different skincare products, which I think are essential when you treat the under eye area. I would say that if you decide to go for fillers, you need to select the right fillers usually. And the rule is that you need to use a soft and low G prime filler, ideally without lidocaine, so you don't have an additional inflammatory process. The lowest cross-linking in the product that you can find in the market. Better always to under-correct, because you need to consider the hydrophilic expansion of the fillers, particularly in a very tiny limited area that you can see significant augmentation of the volume if you put too much. Do not mix with other products. That's my recommendation, but I know there are colleagues of mine that they mix different products in the under eye area. Select the right area to treat, and always assess the whole entire mid face before treating the under eye area. There are side effects, there are issues that you need to be aware and explain to your patients. It could be edema, migration, which is not that frequent, but it occurs, especially if you don't put the product in the right layer. Xanthelasma, skin necrosis is very rare, and visual loss, of course, if you do a vascular complications for the anatomy process that I mentioned earlier. So let me show you examples of tear trough. This is one where you have what we call a grade 1. It's shallow. It's a little of a dark circle with very mild depression. So the technique to treat this is sometimes to put a very thin type of product, aliquots from 0.1 to 0.2 in that small anatomical triangle area that I mentioned. Is subdermally. Remember, there is only 3 layers in that small triangle, and you can use cannula. That's my recommendation. If you feel more comfortable, you can use needle, as it is represented in red. These are examples of that approach, what we call the only or unilayer technique. These are the before, these are the after. So you can see a nice lifting, but mostly the color of the skin looks a little better. This is just immediate post-injection with a very thin product. Here is another example, a little bit more dark than the previous patient, and not so deep. That's why it's still classified as a grade 1, and the approach is still to treat with 1 layer. That's we did here, with a reasonable result after 1 treatment. Now, of course, this is a more advanced case where you have protrusion of the subocular or retroocular fat and probably hyperlaxitude of the septum, which is what I show you in the first slides when we're talking about anatomy. Here, if you decide to put product here, you will make a mess. It will be too puffy and the patient would not like it. So here you need to assess the whole face. What I did in this case is to put support around in the periorbital area by putting fillers in the cheeks, fillers in CK2 and CK3. And then after I did that, I did only 1 layer to recreate a nice and smooth transition from the eyelid to the malar area. So this is a 2nd degree where you have a little bit more hollowness here, a little bit of darkness as well. You need to be aware always of the angular artery and vein that is part of the triangle that we described before. And here is where you can use the bilayer technique. So basically you can go deep with a cannula, enter laterally, and you can put product, again, very small amounts, and 3 to 4 millimeters below the infraorbital rim of a product, which could be a little bit of higher G prime product. And then from the same entry point, you can go with cannula or even needle, subdermally, similar to the first case I showed you, with a very thin, low G prime product. And that's what you can do in this area. So this is just to refresh your memories about the orbicularis oculi, the SUFT, And this is where, if you have the lateral approach, that's when you put 1 or 2 drops of filler here in the periosteum to create a nice lift in that area. And this is what I did in this case. You can see, let me remove that, but you can see how deep and dark the tear trough is here. So I did a bilayer technique with a very reasonable lift in this patient. And then you have the more advanced case, similar to the lady I mentioned earlier. You have a prominent tear trough with mid-fat herniation or protrusion. Here, you always had to consider treatment of the zygomatical malar region and the anteromedial cheek, or CK2, CK3, just to create a nice lifting, and then you can go and treat the tear trough with bilayer technique, as I mentioned in my previous slide. This is an example. You can see the lady with a nice protrusion. This is a more advanced degree of tear trough. If you decide to only treat here, you will make a mistake. So my suggestion here is to create a nice lift of the cheek, treat the CK2, CK3, and then treat the under eye with a different product with bilayer technique. This is another gentleman that has a very advanced and protrusion of the fat, this fat herniation. So what I did in this case is similar to what I showed you earlier. Here I put product in CK2, CK3 to lift, and then I did a bilayer technique to treat the patient. One of the, I would say, criticisms of my own work is that I was trying to overcorrect, and you can see this is a few weeks later. There is still a little bit of a bump here that I had to dissolve with hyaluronidase. So again, my message is do not overcorrect when you treat the under eye area. This is another example of another advanced case. Again, treating the under eye in the deep malar area, and then double layer bilayer technique. The lateral canthus is another area that you can treat with very soft fillers with very good results. You can use masotherapy and you can use PRP. So this is the lady that I mentioned earlier, I showed you earlier, with very good results after 3 or 4 treatments with PRP. So PRP for tear trough deformity and all the pericanthal area and periorbital area is an excellent option, has minimal risk. You need to choose the right system. I cannot tell you which one is the best. You need to decide. But my opinion, that the one that has the highest concentration of platelets and ideally without anticoagulants is probably the best option. And then finally, sutures. And I mentioned this because this is Health Canada approved for now a year and a half. These are an innovation which consists of microsuspension technology that can help you or help your patients to achieve a nice lift and with minimal volumization. These are the sutures. You have 2 large needles with 1 entry point and then 2 exit points, 1 medial and 1 laterally. There are bidirectional cones that then you anchor and you pull. You can displace even a few centimeters the skin of your patients by using this technique. You can again get a nice lift and volumization, and this is how it works. Usually we use 3 to 5 sutures per side, depending on the axis of mobilization that you want to achieve. These are not my pictures. These are pictures from the company, just to show you how you can achieve good results. The material that it's made of is PLLA, so you can get not only the displacement, but also the production of collagen that I mentioned earlier with Sculptra. So these are examples, and you can see that it's sustainable and gets better and better as the time goes by.